Well, Arizona is facing the worst nursing shortage in the nation.
But there is a school that is training the next generation fast. Noha on a graph, she shows us how they are working to strengthen the healthcare pipeline and preparing nursing students to fill critical gaps. We need more nurses.
Absolutely, because the strain is being felt everywhere, really, from hospital floors stretched dangerously thin to school health offices without a nurse on staff. The solutions here, though, are twofold. Pima Medical Institute's accelerated nursing program is getting students to the bedside in less than 2 years, and it's cutting student debt by doing it at a fraction of the cost of a 4-year degree.
E-finger stick is something they learn right out the gate in first semester.
Locate my site.
Then a puncture is one we do in second semester. In third semester, we do teach them how to start IVs and do fluids because now they're in a clinical, more of acute care setting.
The foundations of nursing, all built inside this lab at Pima Medical Institute, right down to patient interactions, everything simulated to mirror real-life care.
We push hard because at the end of the day, they do have lives in their hands.
Because the pressure will be on when they step into real-life settings. Arizona is facing the largest nursing shortage in the country, a projected 28,000 short. Nursing program director Jennifer Morelli says the strain isn't just about empty positions, it's about what happens to patients when there aren't enough nurses to go around.
Units that once maybe had a ratio of like 1 to 5, they're now seeing 1 to 6, 1 to 7. It's hard to give quality care when you have 8 patients at a time that you're trying to see.
5th semester student Yasmin Arcades is already stacking real-world experience with her classes, working overnights as a clerk at a Tucson emergency department. She sees the shortage firsthand.
Sometimes it's just a lot. Burnout is ridiculously high.
She's determined to help stop the bleeding.
If you have the compassion and the empathy and you want to help people, I think healthcare and nursing specifically is one of the best.
Care with compassion is key for Paulina Aguirre.
I had a phenomenal nurse who treated me more like a human than a patient, and I think that really changed my perspective on healthcare.
Her own hospital stay shaped her path into pediatrics.
I think it's really important to treat the patients more like people rather than just room number. I think that's a huge change that I want to make when I become a nurse.
Both will be workforce ready when they graduate in August, thanks to PMI's accelerated associate degree in nursing program, getting students to the bedside in about 20 months. And while the need is urgent,
they are ready to hit the ground running.
Morelli says the solution isn't just in graduation rates, it's in the kind of nurses her students become.
The quality of student that we're putting out there and quality of nurse that we're putting out there is huge. They're full of compassion and empathy. They're phenomenal.
And the need for trained nurses really does run deep. 1 in 3 students nationwide doesn't have access to a full-time school nurse, and Arizona has no law requiring one. PMI, meantime, will connect students with school nursing preceptorships, giving them a direct pathway into that setting, if that's what they choose. And for that associate's program, at a cost of around $54,000 total, it's a fraction of what a 4-year traditional program can run, and many hospitals offer tuition reimbursements so graduates can start chipping away at that $54,000 while they are working.
Wow. Yeah, because you just don't want any, especially cost, to be a barrier for them to get to the bedside like you talked about.
Right.
All right, thank you, Nohe.
Still ahead.